Hi there, I'm Jeanette Connery, a yoga therapist here in Chico, California. And in this video, I'm going to show you an effective technique to use breathing to help alleviate chronic pain. Before I do, please be sure to thumbs up, like my video, and while you're at it, why not subscribe? I'm always posting useful information about self-care practices that you can do at home to feel better. So let's dive into breathing for chronic pain relief. The reason breath works for chronic pain is because the breath is the bridge between the mind and the body. And in yoga, we believe that you can influence any layer of a person's being by accessing a different layer if you need to. So if you've done physical therapy and it's not quite working, you've done chiropractic, you've had a lot of massage, you're getting some results, but maybe not all the results that you want, here's another thing that you can try, right? Isn't it wonderful to know that there's a never-ending resource right here inside your body? So what I want to invite you to do is make yourself comfortable in a seated position. So my back and knees are actually feeling pretty good today, and I'm sitting on a bolster, right? You don't have to sit on the floor. You can sit in a chair. You can even prop yourself up on some pillows in bed, right? The most important thing is that you're comfortable and you're able to breathe easily. So with that said, after you make yourself comfortable, we'll begin our breathing practice. And I'll invite you to begin by closing your eyes. If you're uncomfortable for any reason with your eyes closed, don't worry, you can have them open. Just find a gentle, soft gazing point somewhere off in the near distance. Your hands should be either resting at your sides if you're lying down, or perhaps in your lap, maybe on your thighs or your knees. Palms up or down, your choice. All right, so let's start by getting relaxed, okay? We can only be successful in using breath to alleviate pain if we are relaxed. And we'll start with the head. So bring your head back over your shoulders if that's possible, and relax your jaw. Next, I'll invite you to drift your attention down the sides of your neck. Allow your shoulders to hang there, lengthening the two sides of your neck. And your hands, please check in with your fingers and your hands and be sure that you're not clenching your fists. Drive your attention down your belly, down your back, into your hips. We often hold tension in the hips and the back, contracting muscles when we don't necessarily need them. So check in there, see that everything there is soft and relaxed. And your legs and your feet, of course. Everything is relaxed and soft in the body. And now I'll invite you to bring your attention to your breath. And the first part of this breathing practice is just involving witnessing your breath. We're not trying to do anything to it just yet. And so don't try to change it, make it softer or deeper. Just breathe and watch. And as you're watching, try to notice the parts of your body that are involved with your breath. As you breathe through your nose, you are feeling the air coming in and out through the nostrils. And you're feeling your rib cage move as you breathe. And what part of your rib cage moves? Is it the top? Is it the bottom? And maybe you can even feel your breath down into your belly. Good. Now that you've witnessed your breath, I'll invite you to start consciously breathing down into the bottom of your rib cage. This means that the neck muscles will remain soft. So if you notice your neck muscles and the top part of your rib cage tensing or moving when we did our initial awareness, put extra effort, extra attention into letting those be soft, quiet, and still. The neck muscles and the upper chest. Completely still as you breathe into the bottom of your rib cage. And sometimes when people do this, they notice that it's a little bit of a challenge to keep those neck muscles soft and the top of the rib cage soft. So just notice that. There's no, assessment over whether it's good or bad. It just is. It's the way that you breathe. And over time, that's a pattern you can let go of. Next, I'll invite you to see if it's possible to bring your breath down into your belly. So when you do this, it's important to remember the bottom of your rib cage will expand 360 degrees like an umbrella opening. And then you'll feel a little pressure, and that's on the inhale. A little pressure in the belly as the belly grows on the inhale. And we'll explore this inhale a little bit more. Can you breathe into your back? As you inhale, can you feel the two sides of your back moving to the left and the right? The low back widening out, softening out on the inhale. Good. So let's spend a little time developing awareness of the exhale. On the inhale, there's an expansion, a widening, an opening. And on the exhale, everything pulls back into the center and moves up. The breath moves up and out through the nose. See if it's possible to initiate that inward movement on the exhale from your low belly, as low as possible. And that contraction will work its way up gradually into the bottom of the rib cage as we do a long, full, smooth, easy exhale. Inhale, the breath moves down and expands your body. Exhale, the breath moves in and up. As you inhale, fill your body from the bottom to the top. And as you exhale, exhale from the bottom to the top. Open your eyes, blink a few times, moving from inner awareness to outer awareness. And notice how you feel now. Thank you for joining me for breathing practice for chronic pain. The light in me bows to the light in you. Thank you. Namaste. May you be happy.